This is Joel Hamilton. I'm here at the Schiller Hamilton podcast. I'm really excited to have you here today.
Thank you.
Alex Greenawalt, why don't you tell us a little bit about your title and what you do and why you're here?
Sure. So I am the prevention director at Keystone Substance Abuse Services in Rock Hill, South Carolina. And my job is to do a lot of prevention and education from a community-based standpoint to try to prevent the onset of addiction with substances. So I do so much work with young folks, our students in the schools. We work with churches, business professionals, pretty much anybody to try to prevent and educate safe practices that you can do on your own, in your home, or just out in the community.
It sounds like a really big problem. Where do you start? I mean, you mentioned churches, schools. I mean, if you think about addiction in a community, and if you're trying to prevent that, where do you even start to engage or plug in?
I definitely think you have to look at your data and you have to see what is our law enforcement seeing, what is EMS seeing, coroner's office, and that takes a team approach. So we do a lot of collaborative work in the community and we start with the problem. So the number one problem in our community, but also a nationwide problem, is still alcohol. Alcohol is the number one abuse substance out there. But as you guys may have seen or hear in the news, that opioids are still wreaking havoc on communities. And so that's another problem. So you have to start where the problem is, look at hotspots in the community, and start strategizing prevention and response techniques so that we can at least reach these people to get them help or prevent anything from happening within those areas.
It sounds like a really daunting task. How did you end up in this position? Tell me a little bit about what interested you in addiction to begin with and how you ended up at Keystone and kind of what your day-to-day is like there.
Sure. So I started off my career doing mental health outreach and doing suicide prevention work. So having that background in mental health and seeing the crossover, that dual diagnosis where many people that are diagnosed with a mental health disorder also have some form of a substance use disorder, whether that's misusing alcohol, prescription pills, marijuana, whatever it may be. So I started off with that and I worked for a college campus with their counseling department. And then in time, I branched back out to the Rock Hill area and saw an opening at Keystone, kind of closed my eyes and hoped for the best, and good things came of it. I got the job, and that's really where I got more of my focus in the special category of substance use. But I think having that background of mental health has just been an asset for me to further my career, because having both of that lived experience working with individuals and just the knowledge, I feel better equipped to help these people now that we see the dual diagnosis is so common in the community.
So you've mentioned Keystone a couple times. Can you tell me a little bit about Keystone? What is Keystone? What do they do? I know everyone kind of drives by in Rock Hill and sees it, and that everyone seems to know the name, but I don't think people really understand just the scope and breadth of all the services offered over there.
So Keystone is a substance abuse service center that provides education, treatment, and recovery. So we actually have 3 buildings, and these buildings are within the Rock Hill area right across Piedmont EMS Hospital. And what we all are offering is prevention, which is my department, treatment, and we have specialized treatment services for those that actually are in active addiction. So we have very unique services that not other counties can offer. And some of these unique services are gender-specific groups, like a men's only group that work with men and specialize on growing skill sets to be better fathers, better workers in the community. We also have an all-women's group. And then we have our inpatient services with a withdrawal management. So that's pretty unique. Not every behavioral health or treatment service across the state of South Carolina can offer that. And then we actually have a all-youth building to specialize and treat those youth with a substance use disorder. So those are some of the services that Keystone really specializes in, but the biggest one that we're seeing a lot of impact with from a positive standpoint is our medication-assisted treatment services. And that's really to help counteract this overdose crisis of opioids and prescription pill misuse and abuse.
What does that mean? Tell me a little bit about that.
So as far as misuse and abuse?
The medication. What are you helping?
Yeah.
What exactly does that mean?
So MAT, known as medication-assisted treatment, we're able to offer specialized doctors that sit down with these individuals and figure out what's going on in their world and then prescribe them medication that actually blocks, it's an antidote, so it blocks our opioid receptors. So the individuals that might be experiencing that active addiction, or they may go out in the community, use a substance, whether it's an opioid, heroin, fentanyl, when they're under the influence of MAT, which might be buprenorphine, we have naltrexone. These are medications that block that receptor. So it's helping them get through the withdrawal process and actually come and show up to Keystone, to our groups, and get that treatment. A lot of the times we see without this MAT assistance program, individuals are experiencing the hardships of that withdrawal, which if anyone's ever experienced it, it feels like beyond death. And so to get them over that withdrawal process and still have them show up to group and get those necessary counseling skills and those coping strategies, they're at a higher success rate of getting into their recovery and preventing that relapse from happening in the future. So it's kind of a recap of what our MAT is.
So it sounds like on the prevention side, your job is basically to keep people from having to come into the Keystone, into the treatment programs at all.
Yeah.
So when you're tackling addiction and you're tackling preventing it, what sort of triggers, what are the causes of addiction? You mentioned there's different substances people are addicted to. What's something that those people might have in common, though?
The biggest thing, there's a couple factors when we talk about what can contribute to addiction. And the first thing is your family history, genetics. A lot of times people don't know if addiction runs in their family, whether it's through their parents, grandparents, or so on and so forth. And that is the same thing with mental health. So mental health and substance abuse or addiction, those are things that can run in the family. So that's one factor that can contribute to somebody potentially developing the addiction. Another fact are your choices. So before addiction takes place, choices have to happen. And that might be the misuse or abuse of an alcohol, a prescription pill, any type of substance out there. Over time, when that misuse and abuse leads to a dependency, that's when addiction starts to develop. So the choices are our second factor. And really the third one comes down to your environment. That could be peer pressure. Do you live in an area where substances are easily accessible, readily available in the community? That can play a role. If family members have, it readily around in the household, the environment plays a huge role. So those are three factors: genetics, choices, and environment that can contribute to addiction.
I can imagine, particularly with alcohol, that environment and what you're exposed to and peer pressure probably plays a huge role. And also I think there's probably, it may be more difficult to tell when, someone may be addicted to alcohol versus just being a regular drinker. Where is that line, and how do you start to identify that?
So there's always individual thresholds and tolerance levels. And you're right, it's so hard for even friends or loved ones to recognize when somebody is showing behaviors that look like dependency or abuse of alcohol. But at the end of the day, it's knowing your body's, how your body processes. And we talk about standard drinks all the time. From the prevention standpoint, you have to know what a standard drink is. And our society nowadays does not really have standard drinks. We are a big microbrewery industry across the nation, especially here in Rock Hill. And these drinks all have higher levels of alcohol by volume, ABV percentages. So if you think about a standard Bud Light, generally, 4.5% alcohol by volume, and you compare that to an IPA, some of these IPAs are 7%, upwards of maybe 10, 11%.
That's why people love them, I think.
Right. Yeah, absolutely. But that's where it becomes an issue with drinking and driving, not recognizing how many drinks that you're having.
Yeah, that's true. You might think, I had one beer. Well, having one Bud Light at home versus having
Right.
one of those, it's two completely different things.
It's almost like having two drinks in one with some of these IPAs. So looking for when things start to change over, we look for risky behaviors and patterns. Risky behaviors are you're isolating yourself, you're drinking by yourself excessively. Other risky behaviors are binge drinking. You go out with friends or you're sitting in an environment and somebody is consuming maybe 4 or 5 of those IPAs or a full glass of wine, having a couple of those. That's what we talk about as binge drinking. So these patterns are essentially habits. That's what a pattern is, a habit that someone's doing over and over time. So that tolerance level goes up, but it's the risk that they choose, whether it's to get behind the wheel of their car, if violence starts to take place, relationship issues. These are signs we look for: poor hygiene, and maybe you're withdrawn from the environment, your friends. These are things we look for if they're starting to reach that threshold of getting a dependency toward alcohol.
So I do think there's an idea that addiction is sort of innate, and you mentioned the genetics and family history. So when you're talking about prevention, are you talking more about those choices that you referenced? Because I imagine it's kind of hard to prevent something like what your genetics are, right? So how do you prevent? Is it preventing the behavior? And then if that is the case, is that an educational thing? And, tell me a little bit about how you reach those people and what sort of things you're trying to educate people on.
Prevention is all about education and awareness. So just letting people understand and know about their genetics, getting those conversations happening within their family, and figuring out what runs in the family. Is addiction prevalent in our family? Is mental health? That's the first step. So for those that may have addiction that runs in their family, my conversations with those people are generally, now that you know that, your choices are going to be a lot more impactful in the long run compared to your friend or somebody else who doesn't have addiction that runs in their family. So that's where making those positive choices that aren't contributing toward any type of substance use, misuse, anything like that. When we're talking with youth, anyone under the age of 21, at the end of the day, their brain's still developing. So any type of substance, whether it's nicotine, alcohol, marijuana, pills, if you're using that at the younger age, it really is starting to create those habits at that young age that will carry on throughout college or their later years of life. So knowing if addiction's in your family and the choices that you make is the biggest thing to help these individuals realize how to reduce their risk. And I've worked with a lot of youth in the schools just by that basic message and talking to them about it. And I've had a lot that reached out to me and says, well, my mom is actually, an alcoholic, or my grandparents had some type of substance use disorder. And I let them know, this is something that I'm proud of them, that they started that conversation. They asked their family, but they don't have to be scared about it. It doesn't mean that they will become addicted to substances. But now that they're aware, they can make smarter choices for their health, their life, and their future in the long run.
Now, do you work with them on maybe goal setting or something to help incentivize that behavior or those choices?
We do a lot of life skills, basic life skills behaviors. So that's going to be setting short-term, long-term SMART goals. We talk a lot about self-image, having the confidence, being assertive, standing up for yourself in a positive way. We talk to them about communication. You have to be able to communicate with your family, your friends, be able to express your emotions in a healthy outlet. A lot of these youth are going through hormonal changes, a lot of stress in their life. We talk about this COVID right now impacting these youth so much. So these basic life skills to get them to start realizing what is it that you want out of your life in the next couple of years. It could be something as small as getting onto the baseball team to learning a new instrument. And these goals, we want to work with them. And we talk about, when you use substances, how that's going to impact these goals. And we talk about the consequences to keep that, on their forefront and aware for them to realize these will impact their success in the long run.
So I'm really glad you mentioned COVID, because as we all know, these are very strange times that we live in currently, and everyone's stress level seems to be higher, anxiety seems to be higher, unemployment rates are rising, families are a little bit disconnected perhaps. How do you think all of this impacts addiction? Do those things trigger those bad choices that get someone onto a bad path? And what does that mean for people like you and Keystone in terms of the demand for your services?
We would have never thought when COVID first started that we would see a huge influx of overdoses and individuals that were experiencing addiction. And so since COVID happened back in March, we've seen a massive influx of just overdoses happening in the community. And we definitely know this is a contributing factor with isolation. So many people are isolated because of COVID, job loss, relationships have been impacted. And at the end of the day, Keystone is still trying to stay on the forefront and adapt our services to still keep our doors open to help those that have the addiction and need that sobriety and recovery. So we're seeing a lot of adaptations happen in the community with individuals that are going to AA groups, finding a online one to go to instead, or NA groups. And at Keystone, we are figuring out how best to still provide social distance, cleanliness, anything to keep our doors open to help these people that want to get toward their recovery.
So you mentioned overdoses and how those numbers are going way up right now. When you say overdoses, what are we talking about? Are we talking about fentanyl? Are we talking about opiates? Are we talking about heroin that people buy on the street? I mean, it seems like such a vast problem, and there's so many different ways that people get into narcotics or opiates. Is there a trend that y'all are seeing? Is there a particular way that people kind of get into that world? Or I guess I don't even know how to form the question because it just seems so vast. What are you seeing?
When we talk about overdoses, you have to think that there's two different types. There's non-fatal. They get help from the EMS and they're able to live their life and get the help that they need. And then we have the fatal overdoses. Mm-hmm. Generally, what we've seen over the past couple of years since the 90s is a big upward tick of prescription pills being prescribed. And a lot of these are painkillers such as opioids, Oxycontin, Vicodin, hydrocodons. These are what we call painkillers, pain relievers. So these became a huge, prescribing way back in the day from physicians, dentists, even veterinarians. And over time, throughout the past 10 years, we've seen that 75% of people that started using prescription pills developed the addiction.
75%.
Well, 75% that began with the addiction of prescription pills. So just to backtrack, it's not that somebody will become addicted for using painkillers their first time.
Okay.
Once again, it's those factors. It depends on family genetics. It depends on their choices. Are they misusing and abusing their painkillers? Are they taking more than what's prescribed to them? Are they drinking alcohol while they're using their painkillers? And then the environment. Eventually, these 75% of people get cut off at some point from their doctors when they develop that tolerance or dependency through their painkillers. So they have to find somewhere else to get access to that, whether it's a dealer in the community, a parent or a family's medicine cabinet, getting it from a friend. But eventually sources get cut off, and the next cheap, readily available substance out there is heroin. So that's where we see, 4 out of 5 people that are using prescription pills eventually shift to the heroin. And with the heroin now, since about 2013, we started to see synthetic opioids come into the picture. And what a synthetic opioid is fentanyl. And fentanyl is about 50 to 100 times more potent than morphine. And it's very potent, and it leads to the high chances of overdoses, whether that's fatal or non-fatal. So we're seeing a lot of these synthetic opioids such as fentanyl being mixed into this heroin. And that's where we're at today, where we're seeing a huge number of people overdose fatally and non-fatally. And it's because of these synthetic opioids that are out there.
Wow. So I think there's maybe a misconception. Honestly, I think a lot of people don't really understand how no one really wakes up in the morning and says, you know what, today's the day. I've never tried it. I'm going to go out on the street and try to buy heroin. So you're saying it really starts over a process, and it may start with something like an injury, a surgery. a legitimate medical event where somebody is prescribed something that's designed to help them recover from that medical event, but then unfortunately something bad happens along the way. When people start to go into, I guess, a slide where they start to abuse those pills, if your goal is to try to prevent it, is there a time or a way that someone should reach out to you, that you would ideally become engaged in that process? Should there be some prevention on the front end when those things are first prescribed? What is the ideal way to sort of handle that so that you prevent that person from sliding down into the first place?
So our big prevention strategies, once again, are education. And we first start with our youth, because eventually in your younger years, you start to develop those habits. So those habits might be taking these pills from a family's medicine cabinet, taking it from a friend who you trust. We start talking to them at the young age. You do not take pills that are not prescribed to you. You take it as followed. If the doctor does prescribe it for maybe a sports injury, wisdom teeth removal, follow the instructions, and that prevents the misuse. But other prevention strategies that we try to do a lot in the community is educating our prescribers, letting them know out there, here's the resources we have in the community at Keystone. We have MAT, Medication Assisted Treatment Services. We want to make sure that these individuals that are getting prescribed their medication aren't getting it prescribed for a long period of time. So since this opioid epidemic has wreaked havoc on the nation, a lot of our prescribers have gone from a 30-day supply of giving their patient, 30-day supply of prescription pills to generally just the 3 days coming off of their surgery or whatever procedure that they're having. And that allows the prescriber to be able to come back to the patient and say, how are you feeling? Where are you at right now with the pain? So that's one way to prevent overprescribing, and it's having those educational conversations. Other things that we do on the prevention standpoint in the community is really making sure that people get rid of unused or expired medication. You would be surprised the amount of people that we hear at Keystone that first got their hands on painkillers was just going to a friend's home. They're walking through someone's house, they go to the bathroom, and that medicine cabinet in there isn't locked. So they're getting access to anything from Xanax, Adderall, pain relievers. And this is one way that people get access to it. So from our prevention strategy, we want to get rid of unused or expired medication. So we're doing a lot of distribution in the community with at-home disposal bags, and that's something that our prevention office can provide free to anyone in the community. And then we're also encouraging for those that have, baggies filled of those, those pills that they've filled up over the years and never used, maybe they expired out. We actually have 7 permanent drop box locations here in York County. All 7 of these are located at police departments, including Winthrop University Police Department. So we're always encouraging people, get rid of these pills because that eliminates the access. Mm-hmm. And like I said, over time when an individual that was first prescribed a prescription pill for a legitimate purpose, when they get cut off from that source, they're going to look for that next readily available source. So get it out of the household, and that prevents the addiction from carrying on there. Other just basic prevention messaging is joining together with communities, with businesses, getting people trained on how to recognize the signs for misuse, abuse, stuff that we can practice on our own or help other people in the community. Once you know how to help somebody, just like basic CPR, more people are likely to administer Narcan, which is a overdose reversal antidote. It's a chemical that is a nasal spray. More people are likely to administer Narcan than they are CPR. So I feel like having the education and these resources within your business, your practice, your organization can help save lives in the long run.
So let's talk about Narcan a little bit. You mentioned the fatal and the non-fatal overdoses that you see. Is it Narcan oftentimes that's the difference between an overdose being fatal or non-fatal?
It's not the Narcan. That Narcan will not make a difference if you are experiencing maybe a overdose from meth, from another substance, it's still going to impact only the opioid receptors. So Narcan's not the deciding factor between fatal or non-fatal. It depends on how quick somebody's able to administer Narcan. That's why we want everybody in this community to have it on hand, in their pocket, in their car, in their home, because it takes a little while for EMS to get there, depending on where they're being called from. So that's really the deciding factor between fatal or non-fatal. Was EMS able to get there in time? Was this individual responsive when somebody arrived to the scene? And were they able to get that Narcan to them as quick as possible to reverse the overdose? But the ones that are fatal, it all comes down to that time. They just weren't able to administer Narcan in time, and at that point they were declared deceased.
So you're saying even if I don't know anyone that has any addiction issues, even if I don't myself have any addiction issues, that it would maybe be a good idea for me to have Narcan in my vehicle or on me in case I'm somewhere and I happen to come upon somebody that's having an overdose?
Absolutely. Once again, you are more likely to administer Narcan than you are CPR. Every organization, business, and even in your own home has a medical kit. We have Band-Aids. We have stuff to help treat issues. That Narcan should be in all these medical kits within our businesses, agencies, and homes, because you never know when you might have to save a life. And those lives are worth saving because that gives them another chance to go through Keystone's treatment services to get whole and to heal and to succeed.
So that raises a couple questions. First of all, I don't know if that's something that's readily available. Like, can you go to CVS and buy Narcan, or how does one even get that to have in their medical kit?
We have seen a lot of improvement over time nationally with some bills that have passed to allow more Narcan access, but it's still a big barrier that we see in York County. Keystone Substance Abuse Services offers free Narcan to anybody. We don't ask questions, we don't ID. There are also throughout Fort Mill, Rock Hill, Clover, and the York areas, a couple locations that might be the Walmart, a CVS, or another pharmacy that will offer Narcan. But the deciding factor for those agencies are there's usually a price involved. Not everybody can afford that Narcan. Insurances, if you have insurance or not, plays a role. So luckily, Keystone is the one agency in all of York County that can provide it for free. Doesn't matter if you have no money, doesn't matter about insurance, it's free. But we still see Narcan, the lack of Narcan access is a huge barrier nationally, but here in York County as well. Ultimately, we would love to have Narcan blanket the town. It should be in parks, bathrooms, gas stations, and every business out there.
So like on the wall in the gas station next to the hand soap, thing of Narcan.
Absolutely.
So say that I take the step, I go get Narcan, I keep it in my first aid kit in my vehicle. What do I look for? How do I know when someone's having an overdose, and how do I know when to administer it?
So the basic signs that we talk about when someone's experiencing an overdose, things to look for is the unresponsiveness, the pale blue clamminess of the skin. But the biggest key factor I let people know is the pinpoint pupils of their eyes. If you think someone is going through maybe a heart attack versus some other type of distress, with an overdose happening, we always look at the pinpoint pupils of the eyes, and that's a key factor if they're experiencing some type of overdose. So
if their eyes are closed, you want to open them and see if you can tell?
Yes, absolutely. And when you experience and start to see these symptoms, if Narcan's on hand, we say immediately pull that out and start to administer it. If it's the nasal spray, all you have to do is push that little button up through the nostril of their nose, and generally their body will respond to it. It may take a couple doses, though, depending on the substance that contributed to that overdose. Now, if you don't have Narcan on hand, we say the first step is immediately call 911 so that EMS can arrive on the site, and that would be the difference between getting someone help in time to save their life for a non-fatal overdose versus you're not getting them the help in time that can lead to a fatal overdose.
So it kind of seems like something like, oh, what are the chances of that? But it's increasing, right? And what are the numbers like in this area?
So since COVID's begun, we've seen a huge upward spike of overdoses. And just back in April, we saw 44 overdoses here in York County, and that's a mixture between non-fatal.
So you said since April there's been 44.
Since April,
Wow.
but from
Are most of those in Rock Hill, Fort Mill, or do you know where most of them come from?
A majority of these overdoses are happening in hot spots throughout Rock Hill, Fort Mill, and Clover. Now, that's not to say that other areas aren't experiencing that, but those are our more heavily hotspot areas. Now, April saw 44 overdoses, but it got worse in May. We saw close to 72 overdoses here in York County. Now,
how many of those were fatal versus non-fatal?
That I'm not too sure. I think we're seeing more of the non-fatal, which is good news.
Right.
Our EMS, law enforcement, or somebody is on site administering that Narcan in time. So that is a good sign. But we're just seeing these numbers get worse and worse each month. And just a few weeks ago in July, in 1 week, 7 days, we had 22 overdoses. Now, 19 of those were non-fatal, and 3 of those were fatal. But if you think about it, that is somebody's loved one, their family, their friend. These are people in our community that, like you said, they didn't wake up and expect for that to happen that day. These are people that have a worthy life, and that's why it's so important that everybody has access to Narcan.
So, yeah, the individual lives are obviously impacted a great deal. And I think the other thing that people don't think about is the impact to the community and the resources that it takes to, on the prevention side, the treatment side, the saving lives, the medical and treatment care that's required. I know a lot of counties, York County included, has actually brought suit against some of these companies making these products to help mitigate the impact of these things. Have y'all looked at this impact in York County and what that might be?
Now that we're seeing since COVID so many overdoses impacting us, we're starting to take a deeper look at how it's impacting the community with a price factor. Hospitals are seeing influx of non-fatal individuals come through their doors, and that's causing, hundreds of thousands of dollars impacting them. From a treatment standpoint, Keystone's a nonprofit, so we're doing everything we can to help keep these people through our doors, regardless if they have a penny in their pocket. But we as a treatment provider, we have to get more backup from federal dollars, state dollars, and even our insurance. And that's a big thing. A payer-based strategy is something that we hope to see our future move towards, so that insurances are allowing these individuals to come through our doors at a cheaper cost that's not impacting their wallet. We're seeing from the law enforcement standpoint, a lot of them are being deployed out to these areas where overdoses are happening, and it becomes a consistent basis with relapse over and over. So that's taking a toll on their officers as well. So it's definitely, from a community standpoint, millions of dollars that's impacting us that we can do something, whether it's from a prevention standpoint or a responsive standpoint. And you save a lot more money when you can prevent an issue than having to treat it. So that's why we always encourage people to invest in any form of prevention, whether it's a basic education for your staff and employees at your agency, whether it's in a school-based setting, talking with youth about prevention. At the end of the day, if you're investing close to $7 toward prevention, it's going to save over $3 in the long run for each individual that wouldn't have to go through treatment services. And if you put $3 to each person in York County, thousands of thousands, close to millions that we're saving.
Again, the problem just seems so vast as when you talk about the community as a whole, or the state as a whole, or the nation as a whole. Is it daunting?
It is, but there's a lot of hope. There's a lot of people that come through our services or don't come through our services, and they get the help that they need, and they are successful. They're in, high positions. These are people that anybody can experience a substance use disorder. It could be a lawyer, a doctor, a teacher. It could be anybody. Addiction does not discriminate. So as daunting as we hear in the news and on the radio about overdoses happening, addiction happening, there's a lot of hope out there because addiction's treatable. Just like diabetes and hypertension, you can manage it, You can treat it. And at the end of the day, there's hope for a great, healthy, successful life.
I think that's really well said. And I also think my big takeaway is that people need to contact Keystone, whether they want to help on the prevention side and help and, maybe give resources or volunteer. If someone's stumbling into a pattern that they find troubling, they really need to reach out on the prevention side. If they're in a pattern or a loved one is, they really need to reach out, because it sounds like there's a lot of good that you can do. I have a question. So pretend for a minute that you could wave a magic wand and just solve the problem. What would that solution be?
Obviously, we would hope for a drug-free world.
Mm-hmm.
You want to wave the magic wand, we would want a drug-free world. But what would be the solutions that contribute to a drug-free world? Having better access to treatment services. That's the biggest thing. There's just not enough access from a money billable standpoint. So many people hesitate to reach out and get the help that they need because, one, they can't afford it. That's the biggest factor. And two, there's stigma. There's so much stigma involved with individuals that are struggling to reach out for themselves or a loved one because they're scared to speak up and say, yes, myself or somebody I know is experiencing addiction. So to wave that magic wand and eliminate these barriers of stigma that exist in our community, more people would be reaching out for help. And that's what we want to see for our future. More people getting the help, not feeling ashamed. This can affect anybody, and it does. You're not alone.
Mm-hmm. That's pretty good. Well, Alex, it's been awesome. Thank you so much for coming by today.
Thanks, Joel.
Is there anything else that you want to get out there about how can people contact you? How can people contact Keystone? Tell us how people reach you or anyone else that they might need there.
So to reach me for prevention services, we're offering a lot of education based off of this conversation today. We're opening up our services to go virtual and reach your business, provide training. We're doing a lot of Narcan distribution events. We're working with anybody you can think of, and not just on prescription pills, on any substance. So to reach me, you can call me at my number, which is 803-230-2164. And if you or somebody you know needs help from our treatment side, please call our main line at 803-324-1800. We also have a website, KeystoneYork.org. Go there, look up some services. You can reach out. It's confidential. Nobody's here to judge you at the end of the day. We want to help you and get you on that road to success of health, hope, and healing.
Well, hopefully in the near future, we can get together and talk about some more successes at Keystone. Again, thank you for coming today. And anyone listening, thank you for tuning in and hearing what Alex had to say. If you have any ideas on any other topics, anyone listening, or if there's someone of interest that you would like us to speak with, please don't hesitate to reach out to Schiller Hamilton Law Firm. You can reach me at jhamilton@schillerhamilton.com. That's it. Thank you, Alex.
Thanks, Joel.
Yeah, talk to you soon.
Bye.